Hello and welcome to Nurses Handbook. Today I have brought to you some multiple choice questions from the subject Fundamentals of Nursing. Question number 1. Which of the following is not an essential value for a professional nurse? Option 1. Dependence. Option 2. Human dignity. Option 3. Social justice. And option 4. Integrity. And the correct answer is option 1. Dependence. Nursing values are principles and standards that nurses follow to ensure that they are doing an ethical and quality work. Some of the important nursing values are human dignity, integrity, altruism, social justice, diversity, ingenuity, compassion, trustworthiness, accountability, curiosity, autonomy, precision, empathy, professionalism, loyalty, and excellence. Question number 2. Which of the following would not promote trusting the nurse-patient relationship? Option 1. Maintaining confidentiality. Option 2. Fulfilling promises. Option 3. Returning at the stated time. And option 4. Examining a wound without providing privacy. And the correct answer is option 4. Examining a wound without providing privacy. Taking such an action by the nurse would hamper the nurse-patient relationship, the effective communication, and the quality care between the patient and the nurse. Question number 3. In Maslow's hierarchy of physiologic needs, the human need of greatest priority is option 1. Oxygen, option 2. Love, option 3. Nutrition, and option 4. Excretion. And the correct answer is option 1. Oxygen. Maslow's hierarchy of need is a theory of motivation and personality which was developed by the psychologist Abraham H. Maslow. The most basic physical requirements are food, water, oxygen, sex, sleep, homeostasis, excretion, etc. And they constitute the lowest level of the need hierarchy. When these needs are unmet, human beings will focus more on satisfying them and will ignore the higher needs like safety, love, esteem, self-actualization, etc. Question number 4. Medical asepsis differs from surgical asepsis in the manner that it is aimed at option 1. Killing all microorganisms, option 2. Preventing entry of microorganism in body, option 3. Sterilizing all equipments, and option 4. Preventing transmission of microorganism. And the correct answer is option 4. Preventing transmission of microorganism. Medical asepsis is a clean technique which kills some microorganisms to prevent them from spreading, whereas surgical asepsis is a sterile technique and that completely kills and eliminates the microorganism. Question number 5. Which type of isolation is most appropriate for a patient diagnosed with methicillin-resistant Staphylococcus aureus, that is MRSA pneumonia? And the options are first, respiratory isolation, option 2, reverse isolation, option 3, contact isolation, and option 4, all the standard precautions. And the correct answer is 3. Contact isolation. Firstly, let us see what is contact precautions. They are intended to prevent transmission of infectious agents which are spread by direct or indirect contact with the patient or the patient's environment. And to prevent MRSA infection, contact precaution needs to be taken. So now let us see these precautions. First is isolating or cohorting MRSA affected patients. Use of gown and gloves by the attending staff as well as by the visitors who will be coming to visit their patient. Third is thorough hand washing to be done after attending the patient, maintaining a general cleanliness and safe disposal of all the waste that is produced at the patient site. Question number 6. Infectious non-sharp waste is collected in option 1. Black bag, option 2. Yellow bag, option 3. White bag, and option 4. Blue bag. And the correct answer is option 2. Yellow bag. So what comes under the infected waste? Soiled waste like dressings, blood, body fluids, anatomical waste, chemical liquids, cytotoxic drugs, laboratory waste, expired and discarded medicines. All this comes under the category of infected waste. This waste then is sent to undergo the process of plasma pyrolysis or incineration, and after this procedure the waste is sent for the deep burial. Question number 7. Cleaning of thermometer needs to be done in dash direction after taking temperature. Option 1, stem to bulb. Option 2, midway between stem and bulb to stem. Option 3, bulb to stem, and option 4, midway between stem and bulb to bulb. And the correct answer is option 1, stem to bulb. It is done in this way, keeping in view the principle that is cleaning should always be done from more clean area to the less clean area. Question number 8. Gradual increase in rate and depth of respiration is known as option 1, hypoventilation, option 2, Kussmaul's respiration, option 3, Cheney-Stokes respiration, and option 4, hyperventilation. And the correct answer is option 2, Kussmaul's respiration. It is typically an indication that the body or organ have become too acidic. In an attempt to expel carbon dioxide, which is an acidic compound in the blood, the body starts to breathe faster and deeper, and that is known as the Kussmaul's respiration. And it is mainly seen in patients with diabetic ketoacidosis. Question number 9. During physical assessment of children, asymmetry of the skull indicates option 1, osteogenesis imperfect, option 2, craniosynostosis, option 3, hydrocephalus, and option 4, craniotabes. And the correct answer is option 2, craniosynostosis. What is craniosynostosis? It is a birth defect in which the bones in a baby's skull join together too early. When a suture closes and the skull bones join together too early, the baby's head will stop growing in that part of the skull. And on the other side, where the sutures have not joined together, the baby's head will continue to grow that side. Question number 10. Which of the following statement is true about nursing diagnosis? Option 1, it identifies disease. Option 2, it predicts the prognosis. Option 3, it aids in the quality of care to meet the client's needs. And option 4, it studies the cause and effect of illness. And the correct answer is option 3, it aids in the quality of care to meet the client's needs. We must remember that nursing diagnosis is different from the medical diagnosis. So what is basically a nursing diagnosis? It is a clinical judgment about individuals, family or community experiences, responses to actual or potential health problems or the life processes. For any queries, please post it in the comment box. We will be happy to reply you. And for more videos like this, do like, share and subscribe to our channel Nurses Handbook.